everybody. Welcome back to Emotional Mojo. All right, you need to ask yourself a couple questions. Are you exhausted? Okay, honestly answer that. Do you have any health problems that don't seem to go away? Or maybe you're feeling just plain out of balance. If you answered yes to any of these questions, you need to pay attention because we have Dr. Grady Goolsby here to get our energy flowing with a natural twist and help you possibly find some answers. Welcome to our show.
Thank you.
This is really interesting. So you use this method. It's called Contact Reflex Analysis on your patients, or CRA. What is that?
Well, Contact Reflex Analysis is an analytical tool that we use in our office to help assess the functionality of the body, along with all of our other tools, you know, blood work and MRIs, X-rays and all of that. This is just another tool in our toolbox that we help to get a little bit, or hope to get a little bit deeper and find some underlying causes of people's issues.
It's
so
interesting.
Is it a particular area of the body that you can find with this?
No, we assess the entire body.
The entire body.
Right.
Okay.
So we're going to get to an example of how it works, but there's something I'd love to ask you about because we see these studies all the time. I'm curious about cell phones and the electromagnetic frequencies that they put off. Can they weaken our immune system? I mean, we've heard all kinds of different conflicting theories. What do you think?
My opinion is that they do. There's a lot of research and science going on right now, and I imagine we will find out the answers to that 5, 10, 20 years down the road. But we definitely know that it affects us because cell phones give off a lot of electromagnetic energy, and we are electromagnetic. We have energy flowing through our nervous system, through our acupuncture meridians. So when you interfere with that, you're going to interfere potentially with the homeostasis of the body, which is the normal function of the body.
And it's good you mentioned energy because that's what you're looking for when you're using CRA.
That's correct.
Let's have you do a demo. If someone were to come and see you, I know you use a lot of methods, but you're just going to show us a couple on Tara here and kind of tell us what you're doing as you do it.
So what we do is we use a technique, and it's called applied kinesiology by some. It's muscle reactivity. So what we do is, because the body's electromagnetic and there's energy flowing through, and when there's areas of problems, it interrupts that. So I'm just going to do a little demonstration of how. So we test against a muscle. We're going to be testing her deltoid muscle. Okay, hold tight.
Pretty strong. Watch out.
It's pretty strong. I know, you're strong. P90X, yeah. So we can go and touch
That's
her.
what I told him earlier.
So we can touch her right here, and she can hold as strong as she wants, and it'll blow right out. So that's just a little test point.
But what does that tell you as a doctor?
Well, right now that just tells me that she's testable. Now what we would do is we would go through other, hold tight for me. Okay, we would go through other reflex points throughout the body, and if one of those blew out, then we would know from about 50 years of research what that would tell us, okay? Like if the liver point blew out, for example.
Oh, so there's different points related to different organs.
Right, organs and systems.
Okay.
So then we'd be able to say, okay, you need this particular nutrition, this particular treatment is what we would recommend.
I like this because instead of, sometimes you go to the doctor and they're just going to treat the symptoms. Like, oh, your skin's bothering you, here's a cream.
Well, especially with things like fatigue and headaches and things that you don't, it's hard to pinpoint what that exact thing is.
Headaches, for example, have a lot of different causes. Yes. All right, so what we try to do, just like an electrical light, if an electrical light's flickering, there could be a lot of issues with that. So we change the light bulb, nothing happens. So we start tracing the circuit until we find the problem. Maybe it's a problem with a switch. Maybe it's a problem with the wire, okay? And we're over here changing light bulbs all day, all right? And that's where we don't get
Thank you
the
so
results.
much. That's really interesting, you guys. Dr. Goolsby, you're amazing. If you guys want more info about CRA, you can visit CRA.com or CRAwellness.com, correct?
Yeah, CRAwellness.com.
Yeah, check that out and get some more info. All right, don't go anywhere. You're watching Emotional Mojo. We will be right back, you guys.